Good evening and welcome to the open book. Thank you so much for joining us tonight. I know this is a special day and a special time, and we thank you all for joining us on a Sunday. I know some of you are watching football, but hey, you can watch us tonight as well because we're going to actually go over something that is near and dear to a lot of our hearts because it may have impacted us or someone close to us. And so tonight we're going to discuss, because it is Breast Cancer Awareness Month, we're going to highlight a special organization called the Barbara Cares Foundation. And not only are we going to do that as we speak with our special guest, Xavier Sanders, which is the president, we are also going to hear from two women who are going to share a powerful testimony that are expert witnesses at what the great physician can do in their lives while they have conquered and survived something that many have been faced with, which is cancer. Also, we have a doctor on here, Dr. Skrine, which is a breast doctor. She specializes in breast disease, and she's going to also give us some very important information. She's an expert on the science side of what takes place and the importance of getting mammograms. Okay. If you don't know, 1 in 3 women, or not just women, but 1 in 3 people could be possibly diagnosed with cancer. And so what we want to do is make sure, because early detection is key. And so some things that we're going to discuss tonight will hopefully resonate with you and just show the importance of just checking and making sure that we're okay. And so although this is a serious topic, you know how we do it at the open book. We're transparent, and we love to have fun. So we're going to just enjoy tonight, get you some snacks, and just join in for a little conversation as we talk about some great things that are happening in regards to breast cancer awareness. But first, we want to start. We have a special guest on here, Miss Jhillian. Now, y'all, I'm a part of this Facebook group called Village Moms. And when I tell you, because, you know, with motherhood, sometimes I'm just thinking I'm winging it. It's a hard thing. And so you have to have a village. Because raising kids is hard. And so with Village Moms, and shout out to the Village Moms that are on here. We actually have some live participants who are Village Moms on here. So I'm so excited. But y'all, this group is so supportive, provides a lot of feedback. We can be transparent with one another, ask advice, and so forth. Well, Jhillian, she every Saturday, she posts a Selfie Saturday comment. And so yesterday, I was excited that I actually had something to do, because for the past few Saturdays, I felt like I was taking a nap on my selfie or in my weekend dress. So I had a chance to switch it up yesterday. But one particular Saturday, I noticed that Jhillian had a post about making it out of surgery, and she had shaved her hair, and she shared a little of her testimony, and it really touched my heart because it showed her strength, it showed her courage to even share that with us. And so when it was time to think of people on here that I wanted to share testimonies, she popped into my mind. So I said, you know, I can ask her, she can say yes or no. And I'm just so happy that she said yes, because I feel that someone will be blessed by her testimony tonight. And so, Jhillian, if you could go ahead and tell us a little bit about yourself and share a little of your testimony tonight with us.
Yes, ma'am. Good afternoon. My name is Jhillian. I am a 39-year-old woman with 2 babies, and I live in Houston, Texas. In regards to my diagnosis, I was diagnosed in November of last year with breast cancer, invasive carcinoma. And I'm actually triple positive, which means that it was considered the more aggressive type of cancer. How I found it was my own self check. I noticed that I had a lump that was, getting a little bit, it had gotten bigger over time. And so I went to my doctor and I asked, and he's like, hey, can I check this out? Because I've had mammograms before, I've had ultrasounds, because I've had lumps and everything has always been okay. So I didn't think anything of it, to go and just have it done. And I was relaxed, just no issues. And then, you get a call like, hey, you need to go do a biopsy, or your mammogram comes back. I think it's like the BIRAD 5, which is like the top, very significant, like, hey, this is very suspicious, suspicious of malignancy, they say. And so I had the biopsy done. Then a couple of days later, they call and say, it is cancerous. Find that out, when you hear that word, you kind of, I don't know if I was kind of preparing myself to hear it, or like I already knew because of the other tests that were done. But you always have the glimmer of hope, like, hey, maybe they were wrong, or maybe it's nothing, but it was something. So I ended up, all of a sudden everything just starts like a steamroll. Like, you have these doctor's appointments, you meet your oncologist, your breast surgeon, you're meeting the radiation oncologist, you're meeting everybody, because you don't know exactly what all you have to do. So you're just meeting people. Get to the point to where, okay, well, Jhillian, the doctor said you have to do chemo. Scariest thing for them to say to me, because just of how, TV, and I've never known anybody, honestly, to have, not close to me, to have cancer. So I wasn't quite sure what to expect. I'm thinking of, what I see on TV, or what I see from a distance. But my oncologist said Kelsey Sibo she is great, very warm, very informative, very accommodating. So she made me a little bit more comfortable, I guess. So I ended up having to do 6 rounds of very aggressive chemo, knocked me on my behind, but I made it, and not without, some side effects, but I think I did very well. So in I think my final chemo was April 6th, when I was able to ring the bell, and I was very excited. That is when I actually came and told everybody outside of my close circle. When I posted to Village Moms, or I posted to my Facebook page, because I wanted it to be to share that not the final, but that triumphant time in my life with everyone, and be able to and so more so encourage people, and just to remind them that, hey, you have to make sure that you're getting checked, that you're checking yourself, that this can happen. Never crossed my mind, that something like this would happen. I will say a support system is one of the best things that you can have during these times. And even though I didn't share necessarily with it publicly while I was going through chemo, I did have a very close group of Village Moms that I did share, and they were with me through it all. And you just don't understand how grateful I was for them. They were awesome. Along with my partner, my fiance, and my children, awesome to have, because they encourage you. They tell you, hey, don't give up. This you're almost there. Because it was times when you sit and you think, like, dang, am I gonna make it? This is hard. Anyway, after chemo, I went through. I actually had a mastectomy. I did a double mastectomy. That went well. No issues with that. So now I am currently on maintenance meds, which means due to the type of cancer, I have to take a year of maintenance meds to basically make sure it's kind of shut off that growth hormone. It's called HER2 positive, which is a normal growth hormone, but it has just the activity is just all over the place. So it's trying to shut that activity down. So once I'm done with that, which is January 12th, then I will be able to get my final reconstructive surgery and be done with that. Well, I do have to continue with hormone pills, but that the hard part is over, I guess. But I just I try to encourage people like, hey, check yourself, make sure that you know what your body is, and anything, just go to the doctor and like, hey, can we check this out, just to make sure, because again, I'm 39, no family history, no close people that have cancer, and here I am, so just encourage you to get yourself checked. So
thank you so much. I'm so proud of you. I'm like, that is hard. And I'm grateful that you're on here sharing the importance of that. Y'all, I will be transparent because this is the open book. That is hard for me to do, to go get a mammogram. And I turned 40. So really, I kind of am on target, because I believe in Dr. Skrine can correct me if I'm wrong on this part. And I think when you turn 40, that's when you're supposed to get them regularly, if I'm correct. And she's going to talk to us more about mammograms. But I was nervous, because of the unknown and so forth. And so even recently, I went for a mammogram and I got a report to come back. And y'all, when I tell you, within that week, my mind went all over the place, because I didn't know, like, wow, I'm like, okay, did y'all find something or so forth? And they said, well, we just need another picture. And so that, regardless, you're still kind of concerned. And so I had to go back and they redid a picture. And so come to find out everything was okay. And I thank God for that. But y'all, it is so important though, regardless of that, to go and get it started early. Because I know we all have the fear. And I know, Jhillian, you talked about some of that fear, even when you went and they said, okay, we need you to come back. No one wants to hear that. But y'all, women and men, because men can also get breast cancer as well. If you feel something, do not let it delay. Just go ahead, conquer that fear, get past it, pray about it, and go and get yourself checked. Thank you so, so much for sharing your testimony. Stay on, because we may have some questions later on. Okay. Okay. And so right now we're going to move right along. We have one more testimony. And this testimony will come from one of the elders from our church, Elder LaVonda Howard, which I met at Dayspring Family Church. And she, when I tell you, every time I see her, she is a walking testimony and a miracle. And so she's on tonight, and she's also going to share with us a little bit about her testimony and how God has blessed her and healed her. I think you're muted, Elder LaVonda.
Good afternoon. Thank you, Lakeisha, for having me on. As always, feel so grateful to be able to tell my testimony to other people. Well, first of all, when I was 5 months pregnant, I had some blood work done. And when I got a phone call back from the doctors, they said, you need to go see an oncologist. Of course, I didn't even know what an oncologist was at the time. And so when I went to go see the oncologist and I talked to him, I found out that he was a cancer doctor. So at that time, he did a bone aspiration just to confirm if I had cancer, which they did. And I found out that I had cancer. I was 5 months pregnant at the time. But at the time, I wasn't really like nervous or anything. My husband was with me at the time. And I was like, okay, what's the next step? And so after that, they didn't do anything until after. It was like my daughter was protecting me at the particular time. So they didn't want to do any type of procedure, chemo or anything like that, to after she was born. So after my daughter was born, I decided to have a bone marrow transplant. And one thing about having a bone marrow transplant, first of all, you have to have a match. And so they tested my siblings, and my sister was a perfect match. We always tell my brother he wasn't related because he wasn't a match. But my sister was a perfect match. And so I had the bone marrow transplant done. And let me tell you, the reason I had the bone marrow transplant done at that particular time, because the insurance that I had was unlimited. So there was no cost for me at all out of pocket. So after the bone marrow transplant, okay, a bone marrow transplant is basically like a blood transfusion. They took my sister's marrow and put it into my body. And so everything went fine with the bone marrow transplant, but 90 days within, that's when things start to get complicated, because my body and my sister's body was fighting against each other. And it lets you know, regardless what science is, your body knows your body. And something had invaded my body. And so my body and her body was fighting against each other. So on October the 1st, on my birthday, I got sick and was rushed to the hospital. At that time, they didn't know what was going on. Let me just tell you, from October to April, I was in the hospital for 6 months. And I can say God has done a lot for me, because in the midst of it, even when I started to get better, I had lost so much weight. The doctors needed to put a feeding tube in me. When they went in to put a feeding tube to me, he said, I never seen anything like this before. I had no stomach lining. Because what had actually happened, I had got a secondary disease called graft-versus-host disease. And so it kind of took over my body. And so they couldn't put a feeding tube in at me. But God has restored my lining in my body. That's all taken care of. Well, you have to realize I was in the hospital for 6 months. So what you don't use, you lose. So I wasn't able to walk. My legs were weak. And so I had to learn how to walk all over again, which I did. And God, I can say no, it was nobody but God. But I can tell you, at the whole time that I was in the hospital, what kept me going was healing scriptures. And from Kenneth Copeland, they have a good healing scripture of ministries. And that's all I can do was just listen to the music, because I was too weak to even get out the bed. I had to have nurses to attend to me. And I have to say, at this time, my girls were 2 and 4 years old at the time when all this happened. But I can say, to God be the glory, because right now, my girls are 18 and 20. And I can just say, God is still in the healing business. And all I can say, that's just one chapter of my story. And I just want to let anybody know. One thing is about being pregnant. If I had not been pregnant, because I was having signs of back pain, they were thinking it was because of my pregnancy, but there was blood work done. And that's when they found out that I had the cancer. So the importance of just going to the doctor is so important. If you know something not in tune with your body, get in tune with your body, because your body gives you signals anyway. And I just want to say to anyone out there, being a cancer survivor in any type is actually what it means, survivor, because you're fighting for your life. And it's continually fighting for your life. And I just want to say thank you, Lakeisha, for having me on.
Thank you so much for sharing that. Oh my gosh, that blessed me. I mean, God has been truly with you, and it shows that he is a healer and works miracles. I mean, for you to go through that and still here, still doing so many things is a blessing. So thank you so much for sharing your testimony. And I pray that that's blessing someone out there to know that God is still a healer. Next, who we have on here now. I want you ladies to stay on, because we will ask a couple of questions, but I want Dr. Skrine to come on and share some of her expertise with us on this topic. She specializes in this area. And so if you're on Facebook or are watching the replay, if you have any questions, feel free to type those questions if you're a live participant, and we will discuss those questions. So Dr. Skrine, how are you tonight?
I'm good. Just finished handing out produce to the community at my church. So I'm a little bit tired and sitting in my car, but that is the beauty of Zoom.
Yes, that's the blessing in all of this. Who would have thought throughout this
Yep.
pandemic, this actually helped us in this area. But we really appreciate you taking the time and sacrificing your time tonight. It really,
it's my
really
pleasure.
it does. So tell us a little bit about yourself and what is it that you do in your field?
Well, I'm a breast surgeon, and like Jhillian said, I would have been one of the doctors that she saw. Oftentimes, treating patients with breast cancer is a team approach. So she was talking about seeing multiple doctors, and that's typically how it works. Usually you start with the breast surgeon, but you might see the oncologist first. And we all work together, the breast surgeon, the radiation oncologist, the medical oncologist, and then there's a nurse navigator typically, as well as the radiologist and various and other nurses and people to assist the patients through the breast cancer patients through their journey. So I take care of women with any sorts of breast problems, whether that's a lump, whether that's sorting out whether or not you have cancer, or taking care of someone who has cancer. And I do the surgical part as far as removing the cancer. So that's either lumpectomy or mastectomy. And I work very closely with the plastic surgeon because reconstruction is an essential part of this whole process. I also work closely with the medical oncologist, or as I like to call them, the chemo doctor, because I've got to know when I need to send a patient for chemo or when to do surgery first. And so, you know, we're all in pretty good communication as to what the patient needs and what next steps are, and really making sure that breast cancer patients' care gets coordinated. One of the other important things that I do is I also see patients who are at high risk for developing breast cancer. So if you have some sort of breast problem, there's change in shape, size, you feel a lump, you develop pain, there's some sort of nipple discharge, you would see me. If you have a diagnosis of breast cancer, you would see me. But also if you're at high risk for developing breast cancer, so you have a family history or you carry the gene, those would also be patients that I see.
Okay, I understand. So, because I know I had a breast reduction. Would that,
right,
like people that have breast reductions and reconstructive, you work?
I work with the plastic surgeon. So you saw a plastic surgeon for your breast reduction.
Gotcha.
One of the cool things is if we have a patient who is rather large breasted, not happy with her breast size, and she gets a breast cancer diagnosis, I can work with the plastic surgeon to do the lumpectomy instead of mastectomy. And then the plastic surgeon will do a reduction in order to make sure that she gets symmetry and a lift. So as we like to call it, the upgrade. You can go from a cancer diagnosis to a perky pear, whether that's with lumpectomy and a reduction or with a mastectomy.
Oh, okay, I understand now. Okay, because I watched one of the, I think it's called one of the Merits in Medicines, and one of the actual doctors, she was high risk. And she did something like that because of she had the whole reconstructive surgery. She didn't have breast cancer, but because she was high risk, she had to go through that process. But it made me think about that. So what generally are some signs or some things that may be of a concern that we should actually go to a doctor and see about?
Well, one of the things is I find is that a lot of women go, I don't examine my breast because I have no idea what to feel for. One of the things that nobody ever really talks about is that in general, women's breasts are lumpy. It's not like you go and do a breast self-exam and everything's all smooth and fine in there and there's a lump. There's all of this sort of lumpy tissue. So typically what I tell my patients is, okay, I'm doing your breast exam today because they would be in the office seeing me. And so whatever you feel is normal for you. And then what I tell them to do is to do their breast exam every day for about 2 weeks. And you want to do your breast self-exam in 2 positions, lying down and then either standing or sitting up. because there are things that you feel in those different positions that you might miss otherwise. But by doing the breast exam every day, and so it may be you want to start with your gynecologist or your primary care doctor after they do a breast exam, so you know that everything is normal. If you do that breast self-exam every day for a couple of weeks, what you develop is a roadmap in your head, so to speak, the topography of your breast, the lumps and bumps, the ups and downs, the ins and outs of your breast that is normal for you. And then once you go back to doing your breast self-exam once a month, because the recommendation is monthly breast self-exams, typically a week after your period, when you go to do that exam, you've got that topography in your head and you go, oh, this is normal for me. Or you go, oh, wait, I don't remember this being there. So what you're looking for is something new or something different. You feel a lump that wasn't there before, or you feel some lumpiness that has changed. One of the things you can do, you can, if you find something and you're very concerned, you can always call your doctor, the next day or right away. But it's also reasonable to give yourself a couple of weeks, if you're not sure, to follow that lump and see, does it stay there? Does it get bigger? Does it get smaller? Does it go away? If it persists, it stays the same, it gets larger, then you want to seek care.
Okay, I understand. Okay, that's good to know. Now, at what age?
Let me add one more thing real quick, because I didn't mention this. So it's not only lumps in your breast, but it's change in the shape or size of your breast. You can see nipple retraction, you can see skin thickening or skin changes, you could also see nipple discharge, but most commonly what most women notice is a lump. But any change in your breast, so that's an important part of the breast self-exam, is not only what you feel, but what you see. So part of that breast exam is standing in front of a mirror and looking at your breast with your hands on your hips and then up over your head. Sorry about that.
No, that's good to know, because that's the main thing that we hear, I think, a lot of times is, oh, I felt something. But like you said, things can start changing as well, and we need to pay attention to those changes. So I wanted to get clarification from you. At what age are we supposed to start getting mammograms?
Depending on where you look, you can get different information. I still go by the American College of the American College of Obstetrics and Gynecology and the American Society of Breast Surgeons. And currently the recommendation is a baseline mammogram between the ages of 35 and 40, and then annually from 40 on. And for African-American women, we see breast cancer a lot sooner. I know for a little while there was a push to try to see if we could have African-American women screened sooner. But one of the issues with that is the younger you are, the more breast tissue you have. The more breast tissue you have, the harder it is to see a breast cancer. So you've got to balance when you start doing mammograms with what the woman's risk truly is. So everybody talks about the task force and the task force saying, okay, really you shouldn't start mammograms till 50, which is not what the task force said. What the task force said was every woman needs to talk to her doctor, look at what her risks are, and then decide accordingly. But I still stick to baseline mammogram between the ages of 35 and 40, and then annually from 40 on. And one other important point is, a lot of women 75 or older are told they don't need a mammogram anymore. Biggest risk factors for getting breast cancer are being a woman and getting older. And the nice thing about older women who get breast cancer, I call it old lady breast cancer. It's slower growing. It tends to be a lot less aggressive. So if I can find that early, I can just pluck that out. Oftentimes she won't need radiation. She shouldn't need chemo. We may not even have to take out lymph nodes. And she takes a hormone blocker pill for the next 5 to 10 years and she's good to go. If she doesn't get a mammogram, we wait till it gets to the point where she could feel it, as opposed to something that's pea-sized. Now it's the size of a walnut. Now the whole treatment protocol could change.
So that's why the earlier the better.
Yes, ma'am.
Okay, I understand. Now, what the M word, which is the mammogram, a lot of people fear that. They, we don't know. We hear stories from others. If they're going to do this, what can we expect when you go and get a mammogram? What are some things that you can expect to happen there?
Well, I'm going to preach. I'm not answering your question. I will answer your question, but I'm going to preach for a minute. People say, oh, I don't want to get a mammogram. It hurts. Okay. Do you have children? Do you take them to get their shots? And I think shots hurt more than a mammogram. So if you're going to take them to get your shots, you need to go get your mammogram. Depending on who's doing it, shape of and size of your breast, it can be uncomfortable, but there are certainly far worse things. A standard mammogram, there are 4 pictures that they're going to take, 2 on each breast, one in which the plates go up and down, and then the other which the plates go side to side. So there's 4 pictures. If it's really hurting you, typically, if you let them know that it's extremely painful, they can stop. Some places use pads to help cushion things, but having had lots of mammograms, there is worse pain.
Because I know a lot of people are leery and they hear the pain. I'm a witness that it's really not painful. It's a level of comfort that you have to get used to someone just moving you around up there and trying to get the right picture of anything. But as far as pain, I would not say that it was painful, but everyone has, their own opinion of it. Now, what are some things, if you could share with us, that we could do to prevent cancer, if that is a thing?
Cancer or breast cancer? Or
it could be
both?
Breast cancer.
Okay. So there are risk factors that we have no control over, and some risk factors that we can use that we do have control over. So risk factors that we don't have any control over: family history. If you have family members with breast cancer, you can't change that. If you carry breast cancer gene, you can't change that. At what age you start your period, at what age you stop your periods, how many children you have, whether or not you've breastfed. Those are all things that are risk factors that you can't control. So what can you control? You can control whether or not you take hormone replacement therapy and for how long. Some women absolutely need it. But what we do need to understand is that hormone replacement therapy does not allow you to skip menopause. It just delays the symptoms. So once you stop the hormone replacement therapy, you're going to have to go through that menopause. So discuss with your doctor, do you really need hormone replacement, and what's going to be the endpoint for taking it? Some other things, and these are the things we always don't want to hear about: getting healthy. That has a tremendous impact on your breast cancer risk. A 5% reduction in your body weight, just 5%. So you've a woman that weighs, say, 160 pounds. 5% is just 8 pounds. Losing 8 pounds can reduce your risk of getting breast cancer. Do you want to stop there? You'd like to maintain a normal BMI, but I say that to say people think, oh, I got to lose 80 pounds. Little by little. It's a process. You didn't get to be overweight overnight. You don't have to lose the weight overnight. And I always tell my patients, if you come in every 6 months and you've lost a couple pounds every 6 months, well, in 10 years, that's 40, 50 pounds. So that's significant. Typically people who take weight off quickly, if you take off 50 pounds in 6 months because you do some extreme fad diet, chances are you're going to gain it back. So there's no real benefit. So maintaining a healthy weight is important, but doctors tell you that all the time, and they don't give you really good strategies to do that. I'll get back to that in a second, but I was going to say a part of that is a low-fat diet. Now, we've taken low-fat diets in this culture to an extreme where we've created a bunch of fake food that's low-fat, but of course, it's not healthy. Low fat in God's terms are fruits and vegetables. You can't look at what is available to us to eat, and it's getting difficult because it's pricey, but you can't look at what God has given us to eat and deny there's a creator. If you look at all the nutrients, all the vitamins, all the anti-cancer things and compounds in fruits and vegetables, God did that. And so a low-fat diet to me means a diet that is 70% fruits and vegetables. I don't care if you give up meat or not. Well, I do, but that's a different topic. I don't care if you give up dairy or not. But if you get to the point where your diet is 70% fruits and vegetables, as much of that fresh as possible. If you can't do fresh, do frozen. Try to stay away from canned stuff. It has too much other stuff in it. That's going to be impactful. I mean, I talk to my patients and they're like, oh yeah, I eat lots of fruits and vegetables. And I go through, okay, what'd you eat yesterday? And we go through, and they had an apple and some greens at dinner. That is not a lot of fruits and vegetables. You want to have 10 servings of fruits and vegetables a day. And you do the best you can do. If you can't afford to, you can't afford to. But you know, certain fruits are cheap. Certain vegetables are cheaper than others. Load up on those. If you can do organic, great. If you can't do organic, go for locally grown. They tend to have less chemicals in them. Avoiding beef and dairy. They are highly inflammatory. We know that inflammation leads to more cancer and more breast cancer. You want to exercise and start somewhere. If you go out and walk for 15 minutes and you're doing that, you know, every day for months, I'd rather see that than saying, I don't have time to go exercise. Do what you like, do what you can do, baby steps. Two really important things that we're starting to talk more about that we don't talk enough about though, are it just escaped my mind. Oh my gosh, my mind just went totally blank. Anyway, oh, I know what it is. Stress and sleep. We take those for granted. Those have a tremendous impact. Lack of sleep and stress lead to greater inflammation, which leads to more disease, including cancer. We all need to strive to get 7 to 8 hours of sleep a night. And this has become the best tool for me. You can set it up for your watch to go and your phone to go to sleep. And I have it where only phone calls can come through because I've got college students and they need to be able to reach me. I'm a physician. If somebody needs to reach me, then they can, but nothing else comes through. Uninterrupted sleep is important. And we have to figure out a way for us to protect our sleep and for the mamas out there to protect our children's sleep, because we have babies that aren't getting enough rest. And then stress. And it's easy for me to say, hey, you know, just lead a less stressful life. It's not that simple. We're going to have stress. The questions become how to mitigate some of that. And, you know, we talk about laying it at the feet of Jesus. You develop that relationship with him. You put it out to him, and then you see what tools he gives you. Meditation is important. You know, different activities to help relieve stress. If, you know, going out and swimming helps relieve some stress, then you want to do that, any physical activity, but whatever stress relievers you can. So those are things that can decrease your risk. Healthy eating, healthy lifestyle, low-fat diet. Both cigarettes and alcohol increase your risk of getting breast cancer. So I wouldn't just say cut back, I'd say cut it out.
Wow. I love it. Because that 5% blessed me, because I'm thinking, whoo, I need to lose a whole lot regardless. But just like you said, starting somewhere really, really helps. And could you clarify?
I was going to say, as I tell my kids, how do you eat an elephant? One bite at a time.
Right. Could you clarify what BMI is for those that don't know what that is?
Okay. Body mass index is your height relative to your weight. Some people poo-poo it because it is not the best indicator of overall health for everybody. But for most of us who are couch potatoes, if you don't exercise, where you have, like, bodybuilders have a high muscle mass, so their BMI is not going to be accurate. But for most of us, it is your height relative to your weight. And a normal BMI, the range goes from like 17 to 24. And the easiest way to do it is to go online and pull up BMI calculator, and you can calculate yours real quick. I think, 25 to 29 is overweight. So just to give you a sense, a few years ago, I had to make changes. I had to make changes not only because of my breast cancer risk, but I had to make changes because I was rapidly becoming that elderly, as I approached 60 and thinking about being 65-year-old African-American female with diabetes and high blood pressure. I was 185 pounds. I'm 5'7.5". So my BMI was 28, I think.
Okay.
But changed my diet. Whole foods, plant-based now. And the important point is I lost 45 pounds, but it's taken 3.5 years. I cut out processed foods. That's something I didn't mention. Processed foods have plenty of cancer-causing chemicals in them. And foods with added sugars, we have to start reading labels. So my BMI is now 22, so well within the normal range. Did that answer your question?
Yes, it did. Because some people may not have known, but that really clarifies that. Wow, that is awesome. I mean, you gave a lot of tips and my mind is going because I'm like, okay, what do I need to do because I've been thinking about going vegan and just eliminating like the beef for sure. I've heard a lot about beef and dairy. So thank you for sharing that. And I've been watching the chat to see if we have any questions. So those of you who are watching, if you have any questions, type those questions in and we can ask Dr. Skrine while she's on here. I'm not sure if you have to leave, but we would.
I'm good.
Oh, you're good. Okay.
I'm just sitting in my church parking lot.
Yay, look at God. You're on the church parking lot at that. Thank you so much for sharing that information with us. It really, really blessed me. And I'm writing some notes and I put some notes on Facebook as well. Thank you so much. And last but not least, we have a young gentleman who I consider not only a friend, but a brother. And he is the president of the Barbara Cares Foundation. Y'all, yesterday we had a chance to meet Tabitha Brown. Shout out Tabitha Brown if you're watching this. But y'all, it was awesome. But when I tell you, after he will share his own testimony, but when I tell you the Barbara Cares Foundation has been a blessing to me and my family. Their reach has reached teachers, my children's daycare centers. They have done so much for the community. And you see them visible at a lot of different places, and they're doing a lot of great things. And so tonight we're going to talk with the president of Barbara Cares Foundation, Mr. Xavier Sanders. How are you tonight?
I am good. It's good to see you, Lakeisha. It's good to see all of the panelists, and it's extremely it does my heart good to hear the testimonies. We are in, I like to call it Hope-tober, and it just gives me hope to know that there are testimonies that are still out there and God is still doing what God does best. And it's always good to be a part of the open book.
Thank you. I know that's right. God does what he does best. Okay, so Xavier, let's talk a little bit about the Barbara Cares Foundation. What prompted you to begin that foundation? What led up to that? Give us a little bit about the background part.
So the Barbara Cares Foundation is actually the manifestation and the vision of my mother's heart. My mother, I used to say I lost my mother 3 years ago, but I know where she is. So I did not lose my mother, but my mother passed 3 years ago due to breast cancer. And so one of the things that she purposed for us to do, and she wanted to help people. And even as she was making her transition, she said, Xavier, I want to be able to do something to help people that are going through a breast cancer diagnosis. And so what you see today, 3 years in the making, to God be the glory, it is the true manifestation of what my mother hoped that she could do to help the lives of those that are going through a breast cancer diagnosis, as well as those that are also caring for a patient that is going through active treatment. And so we count it an honor, we count it a blessing, and we are truly humbled to do our small part to help the community and to raise awareness, to help save lives.
Man, and y'all are doing a lot. So what is the mission and vision of the foundation?
So our mission is simple. We provide supportive services to breast cancer patients and caregivers that are in active treatment, while also expanding the access of mammography screenings here in the state of Texas. As Dr. Skrine alluded to, mammograms are important. We have a hashtag with the Barbara Cares Foundation, and mammograms matter. There are 3 different types of mammograms that you can get. We don't care which one you get. Some of them are a little bit better than the other ones, but we just want you to get screened, whether it's the traditional, whether it's the digital, whether it's the 3D mammography. We just want you to be able to get those screenings. And so we are very active in the community for those that are at risk, those that are uninsured, and those that just don't have the financial capacity to afford those screenings. We do everything we can to let you know that we have funding that is available, and we're here to help you. At the end of the day, our goal is to help save lives through early detection, and so that's what we do. 365 is more than October. I know October we get a lot of highlights. We see a lot of pink cleats on the football fields. A lot of people are giving millions of dollars, but it truly is beyond these 31 days in the 10th month of the year. And so we're out here every day trying to do our part to raise awareness and to encourage people that your health matters. So go out there, get screened, talk to your doctor, get healthy, and for the love of God, please fight for your health.
Now, Xavier, okay, I know that y'all do other like giveaways and things of that sort, because y'all, when I tell you, their organization has been a blessing as far as masks. I even had one pink mask. I need some more pink masks, by the way. But the good ones, okay? Yeah. So the good masks for the adults, the children, hand sanitizer, which I'm still using. I mean, they give away a lot of great things. So your focus is not just on breast cancer. What are some other like services that you all, have as well with your foundation?
Yeah, so what we do and what that encompasses is our supportive services. As a caregiver, as one of the caregivers for my mother, one of the things that we notice is that beyond the patient going through active treatment, those that are also providing guidance, support for those that are in active treatment, they also needed help as well. And so we take that in mind to know that even though someone may be going to the doctor, they also need help as it relates to food. And so we provide healthy meals through a partner cuisine for healing, because we know that your temple is important. Even when you're going through treatments, we want to make sure that you are eating the right food. We also want to make sure that your mind is right. Going through a breast cancer diagnosis is very, let me choose my words. It can be very draining emotionally. And so what we want to do is we also want to add that component as it relates to mental health. If someone needs someone to talk to about changes in their body, about, the diagnosis, why am I going through this, whatever the case may be, we provide counseling services. We provide gas cards, because there's a financial toll to this picture. I don't think a lot of people understand that there are financial implications with a cancer diagnosis. And so we provide financial grants. We provide gas cards, we provide healthy meals, counseling services, whatever we need to do to make this journey lighter for you. That's what we do. We've paid off car notes. We've provided air conditioning units because it's 1,000 degrees in Texas. We certainly don't want anyone sweating and going through chemo. And so whatever it is that we can do to help make that journey just a tad bit easier and lighter, that's what we're here to do.
That is a blessing. And y'all, they are doing it. I see all of the posts. If you follow the Barbara Cares Foundation, y'all have Facebook? Do y'all have Instagram? Can you tell us how to follow the foundation?
Absolutely. As you alluded to, we are out here in these streets.
Right.
And so you can definitely follow us on all of the social media platforms. We are on Facebook. I believe our handle is Barbara Cares for You. You can follow us on Instagram at the Barbara Cares Foundation. We also have a YouTube channel as well. I believe it's the Barbara Cares Support Team. anywhere that there is communication being broadcast, you can follow us. You can. The only thing we don't have is a Twitter account. I still don't understand what it means to tweet, and so as of right now, we don't have a Twitter account. But we are grooming some interns, so maybe they can handle that piece and take that off of our plate. But as of right now, we are on Facebook, Instagram, YouTube, and you can obviously find us on our website at www.barbaracaresforyou.org.
And you know what? I have a Twitter too. And what's so funny, I barely use it. The main time I think, or I would say recently, the time that I used it was when Facebook went down. And Facebook was down, Instagram was down. So I said, let me go check my Twitter. So I know how to tweet, but I just don't use my Twitter as much. Now, Xavier, do y'all have like some upcoming events? I know y'all have a big event in October. Can you share with us a little bit about that?
We do. So we are happy to put on our Care to Fight Health and Wellness Fair. Is actually this coming Saturday. And so if you are here in the local DFW Metroplex, the weather is going to be great. I know we got some rain in the forecast, but God is showing us some favor on Saturday. So it's going to be 72 degrees, sun is shining, and the only thing that's missing is you. And so we are inviting everybody to come out. We're going to be doing a host of services. Obviously, with our focus being breast cancer awareness, we are providing free mammograms on site. Let me say that again. We are providing free mammograms on site. Let me say it again for the third time for the ones in the back. We are providing free mammograms on site. We are grateful for our partnership with Texas Health, and so we just need for you all to come on. We would prefer for you to pre-register, but if you come on site, if we do have a spot available, you're more than welcome to get your screening. In addition to that, we're also going to be doing CPR classes on site. Again, our focus is saving lives. I believe everybody in the community needs to know how to potentially resuscitate someone if the need does come. And so we're offering free CPR classes. We're doing blood pressure checks. We're doing free dental exam, free vision checks. We're doing COVID shots. We're providing the boosters. You name it, we're probably going to be doing it. And so all roads lead to 6901 Wichita Street, Forest Hill, Texas, 76140. We're going to be out there from 10 a.m. until 1 p.m. And we're looking for you all to come out there. We got prizes all day, but don't come out there for the prizes. Come out there because you're fighting for your health. Hello, praise the Lord. So we want to see you in the building. We're going to be out there, and I'm looking forward to seeing you.
And if I can just add real quick, we didn't get to have one last year because of COVID, correct, Xavier?
That is correct, Dr. Skrine, yes.
But the first one was the year before last. And let me tell y'all, I had a good time. So it's not just about health.
I think your reception is going in and out right now.
But it's about fun, because fun is time with us.
Dr. Skrine, if you could repeat that, it looks like the audio was going in and out. If you could repeat what you were saying.
Try one more time. I said had fun that day. So come out, get healthy, learn some stuff, get screened, but also have fun.
Absolutely. Please come have fun. Again, our theme is Care to Fight. And I'm not sure if Dr. Skrine had mentioned this before the audio was going out, but our theme is fighting for your health. And so if you have some boxing gloves, we recommend for you to bring your boxing gloves, take a swing at cancer. I was in that ring and I was letting all my aggression come out because we can fight. Let me say that we can fight and we can win. We've heard the testimonies today. we have the ability to take control of our health. And so if you want to come out and take a swing at our on-site dummy, that's the only thing you can swing at. Let me say that, because we are going to have PD on site. But if you want to come out and take a swing at that boxing dummy, come on out, take some photos. Like I said, we have some special surprise guests that's going to be there. And we just want you in the building. It's a fun day. It's going to be a beautiful day. And at the end of the day, we just want you all to just really be conscious of your health, because it really does matter.
I agree. And y'all, he was serious about that. That first one, they had a real boxing ring. Okay. I mean, people were getting in there, just knocking it out. And just the atmosphere was just so much fun. Music, giveaways, everything. But like he said, you can get a free mammogram, and this is the time to do it. That's a very good benefit. And Xavier, is all of this information on your BarbaraCaresForYou.org page?
Yes, we do have the flyer posted on all of our social media channels, and so if you would like, I can certainly put the information. Oh, well, I see the information in the chat on the website. So yeah, check out www.barbaracaresforyou.org, or you can simply do a Google search for "Care to Fight," all one word, CARE, the number 2, and then fight, and there's only one Care to Fight that's out there. And so type that in and it'll pull up all the information regarding that. And there was a question in the chat too that I believe possibly Dr. Skrine might be able to address. So
yes, I did see that. I'm going to get to that part too. I have one more question, and then
absolutely.
We'll get to that part. Okay, so y'all, I want to encourage you to go on his website, okay? Get the information about the upcoming event, but y'all, let's also make some donations. He did not ask me to do this. He didn't know I was even going to mention, but let's also make donations to this organization, because they are doing some great things. I remember that I was at an event where they were doing giveaways. One of the ladies that was there was actually giving away, because she was so blessed by the services that I think her mom received from Barbara Cares Foundation. Okay, so they are doing some great things. Go on that website, BarbaraCaresForYou.org. Let's check out some of the services if you are in need of services, the upcoming events, and let's also just blow them away and just start donating all kinds of money to that organization. Okay, now, Xavier, one more thing. Not only is he the president of Barbara Cares Foundation, but after his mom passed away, he also wrote a book called The Other Side of Real. Can you give us a brief synopsis of what that book is about, and how can we purchase your book?
Yeah, absolutely. So this book was, a brief summation of this book is, sometimes God says no. And I think sometimes that's hard for us to understand that concept, but sometimes God says no. But in that no, there's a purpose that is behind it. And so with this book, it chronicles as far as the journey of from the birth of Barbara Cares to the journey beforehand, to just some hard days that I had walking that journey with my mother. And in that journey, I learned that there's a purpose behind the storm. And so I just want to, this book is an encouragement for those that may be in a hard season in your life. Sometimes you may have your back up against the wall. And I'm here to tell you, brother, sister, it's okay. There's a purpose behind it. Sometimes God says no, but that no shifts you to the purpose that God intended for you. And what I am able to do today, it is because God shifted me during that hard season. And so I just want to encourage somebody that sometimes God says no. And for all of your viewers today, and you didn't have to mention that, but all of your viewers today, if you would like a copy of the book, please feel free to inbox me, send me a message, and I will definitely get that book to you free of charge. I'll do that. In fact, I'll extend that offer through the month of October. And so for those that would like a copy of that book, I know that it'll bless you. Just please feel free to reach out. And from now until the end of October, I will offer that free of charge, and I'll sign it for you. Just let me know where I need to send it.
Oh, that's a blessing, y'all. And the book is good. I read the whole book, and I could relate even having a mom, not necessarily that had cancer, but some of the things that he shared about his struggle and the emotions that he went through, I also went through with my mom. So those of you who are caregivers, or you're having, a parent or a loved one that's going through a health challenge and just need some encouragement, I encourage you to get that book, because it really, really blessed me. It really did. Now, Dr. Skrine and Xavier and anyone else on here, if y'all have questions or anything, just feel free to put that in the chat. But we did have a live participant that had a question. What about those who are concerned with the amount of radiation presented through a yearly mammogram?
No audio. My thing about that is there is a small amount of radiation, but you actually get more radiation going through a metal detector than you do getting a mammogram. So there is a risk, but it's a small risk. And typically, any test we do, you always have to look at risk and benefit. Should you get mammograms several times a year? Absolutely not. But once a year, to make sure there's nothing going on, the risk is minimal. And if you go through metal detectors, that conveys a greater risk than mammograms.
Wow, I didn't know that. Thank you for sharing that, because I did not know that. And I hope that answered your question, Fallon. Does anyone else have a question? Okay, so I don't see any more questions on Facebook or Zoom. So I want to give a special thanks to our guests tonight, Elder LaVonda, Jhillian, Dr. Skrine, and Xavier. Thank y'all for being a part of the open book tonight and just really, really bringing awareness, answering questions during this Breast Cancer Awareness Month, and providing resources. Dr. Skrine, do you have a Facebook page or a way we would like to follow you by chance?
I am on Facebook and Instagram, but they're personal pages.
Oh, personal. Okay.
But God's at work in me, so they may become a little more than personal pages in the next month. So feel free to look me up and follow me or friend me.
Okay, great. Thank you so
much. And I have a Twitter account too, but I'm not on it.
Okay. What is it with Twitter? Okay, no one wants to get on Twitter.
Well, you have to have the desire to tell everybody your business every second, and that ain't most Black folks.
Right. Oh my goodness, y'all. Thank you so much. Please follow the Open Book Club page. We have a Facebook page that we share the events, we share the videos, we share the flyers so that you can see some of the things that we're doing. We host guest authors. We have artists from time to time, comedians, dance, and so forth. And we also host community forums like this, panel discussions on topics that are relevant to our community. So we hope that you all enjoyed tonight. We look forward to seeing you next time. We have a couple of more events this month that we want to highlight in some organizations. I'm not going to ruin the surprise, but you will see some upcoming information regarding our next event, which is October 18th. That's a Monday. So we're starting to pick it up a little. We are usually just Saturdays, but we're having some special times and some special days throughout this month. So we hope that you all had a great time today and you learned some important information, because I know that I did. I learned a lot of important information and some surprises. I only need to lose this 5%. But I am going to shoot to lose way more than
you need to start there.
Look, let me clarify that. I'm going to start with that 5%. But y'all,
yes,
thank you so much, Dr. Skrine.
Thank you, Lakeisha.
You're welcome. And thank you all for joining the open book tonight. And we will see you the next time. Have a great evening. Bye-bye.